The statement that a psychotherapeutic modality is evidence-based often speaks to the clinical effectiveness of a practice, as evidenced by subjective self-report measures of improved psychological well-being or interpersonal and social functioning. That is to say that the research suggests that an evidence-based approach actually makes people feel better. This contributes to the secular-minded client's willingness to be vulnerable with a clinical practitioner and open them up to their inner world. Formalizing therapeutic modalities also provides a framework for educating them in licensed practitioners. Of course, before the era of Western science and the medical establishment's requirement of providing proof of efficacy, interpersonal healing practices found their place in society, in the form of religious rites, meditative practices, supernatural and mystical ceremonies, and the application of mind-altering natural substances. However, for the materialist, who seeks to understand not only that a psychotherapeutic modality works, but also how it is effective at the organismic level, a clinical evidence base only goes so far. It may suffice for the medical community and the layperson who needs to be reassured that a mode of psychological treatment works, but from the biological and neuroscientific perspective, asserting that a modality is clinically effective does little to explain the biological basis for the efficacy of treatment. Enter the neuroscience of psychotherapy. Much of my writing in this space attempts to explore how we can harden up psychotherapy, to understand more thoroughly what happens to the brain and body as healing occurs. This starts with understanding what happens to the brain in psychopathology, depression, anxiety, bipolar disorders, delusions, troublesome ideation, etc. Then understanding what occurs when these disorders are resolved, and finally, how these neurological mechanisms can be operationalized by psychotherapists. A clearer understanding of how a clinician's interactions with a client impact their brain, not only holistically, but with dialectical and neurological specificity, will allow us to create therapeutic modalities that target both the global neurobiological markers of a diagnosed disorder and their constituent components at the electrical and chemical level. In sum, as the evidence base for psychotherapy moves beyond the clinical to the neuroscientific, it could take a metaphysical jump from the treatment of the mind to the treatment of the brain, and mature into the targeted treatment of specific neurobiological regions, processes, and wounds.